Just because breastfeeding is natural doesn't mean it's easy, but you don't have to do it alone. That's where the Lactation Network comes in. The Lactation Network helps parents at every stage of the breastfeeding journey, whether you need support resolving feeding issues, choosing the right breast pump, creating a plan for weaning, or anything in between. The Lactation Network is the largest network of licensed breastfeeding experts in the country. They provide in-home, in-office, and telehealth consultations in all 50 states with no out-of-pocket cost. Get the breastfeeding care you deserve with the Lactation Network. Visit tln.care to schedule your own insurance-covered lactation consultation today. This episode is sponsored by ByHeart. At ByHeart, their goal is to create a future where all parents feel amazing about feeding their baby, no matter how they do it. We know that breast milk is best, but for those of us who have difficulty breastfeeding like I did, or choose not to breastfeed, you want a great alternative, and that's why I am so excited to tell you about ByHeart. ByHeart's patented protein blend gets closest to breast milk by including the two most abundant proteins in breast milk. They even ran a clinical trial where they compared their formula to a leading infant formula and found benefits like softer poops, less spit up, and easier digestion. ByHeart also supports brain and eye development, immune health, and gut health. This company is leading the way. They are the only U.S.-made infant formula to use organic, grass-fed, whole milk, not skim, and they are the only new infant formula brand to add a comparison to breast milk so that they can best understand their closeness to nature's most superfood and all of the magical benefits of breast milk. Curious if ByHeart is right for your baby? New customers get 10% off your first order with the code Dr. Nicole at byheart.com/podcast. That's 10% off your first order at byheart.com/podcast. This is a limited time offer. Additional terms and conditions apply. It's story time, and this time it is a story about how a pregnant patient ended up getting a medical helicopter ride. Welcome to the All About Pregnancy and Birth podcast. I'm Dr. Nicole Calloway Rankins, a board-certified OBGYN who's been in practice for nearly 15 years. I've had the privilege of helping over 1,000 babies into this world, and I'm here to help you be calm, confident, and empowered to have a beautiful pregnancy and birth. Quick note, this podcast is for educational purposes only and is not a substitute for medical advice. Check out the full disclaimer at drnicolerankins.com/disclaimer. Now let's get to it. Hello there. Welcome to another episode of the podcast, a shorty episode. Whether this is your first time listening or you have been here before, you know I appreciate you spending some time with me today. So in these short episodes, I like to share little tidbits, little stories, and this one is a story about how a pregnant patient ended up getting a medical helicopter ride. So here's what happened. I'm at work. I get a call from an emergency department about them wanting to transfer a patient. This particular patient was in her third trimester, but she was preterm. Preterm meaning less than 37 weeks, and she was having abdominal pain, and the emergency department doctor was concerned that it could be contractions. However, this emergency department was at a hospital where they didn't have a labor and delivery unit. So there was no ability to monitor her and see if she was having contractions, no ability to monitor the baby's heart rate or anything like that, because again, no labor and delivery unit. So how did the patient get to this hospital with no labor and delivery unit? Well, what had happened was she was at home and she started experiencing pain. Her sister happened to be at home with her, and when the patient started experiencing pain, her sister panicked a bit and she called 911. So the ambulance came but the nearest hospital with a labor and delivery unit was on diversion. So what that means when a hospital is on diversion is that they are closed for any ambulances, they are closed for any transfer patient. Now, if you happen to walk in the door, you don't know that the hospital is closed, so they would take you if you walked into the door, but they're not going to accept any transfers, any ambulances, because they're already full or they don't have the staff, or for whatever reason they're on diversion. So the hospital with the nearest labor and delivery was on diversion. So in this case, the ambulance took her to the next closest hospital, which, you would think makes sense. However, it did not have a labor and delivery. Now, this patient really definitely needed to be evaluated in a labor and delivery unit. She's preterm, she's pregnant, she's having pain. There's a concern that there's contractions. She needs to be evaluated for preterm labor, try to see what the cause of her pain is. However, the emergency department doctor said that it was going to take at least 4 hours for an ambulance to arrive. 4 hours. And that would be entirely too long, period, but definitely too long if she were actually in preterm labor. Those hours make a difference. So in this case, the only option was a medical helicopter. So the helicopter came, picked up the patient from the other hospital, but on the way to my hospital, there was some potential for bad weather. So the helicopter had to make a detour and land at the airport for a bit to decide if they could make it all the way to my hospital, or if they needed an ambulance to come pick her up from the airport and then take her the rest of the way to the hospital. Yes, this story just continues to get complex. So ultimately, the helicopter crew decided that they could fly safely, and they made it to our hospital about an hour after they had left the other hospital. Okay, so about an hour. When the patient got to our hospital, she was not in labor. We put her on the monitor. Her cervix was closed, and she ended up being discharged home about an hour after she arrived to see me after what she called a scary helicopter ride and experience. KiwiCo Panda Crate is a bi-monthly subscription for babies ages 0 to 24 months. They are perfect for brain-building play and fun. KiwiCo baby products are made with care. They are free of BPA, free of lead, and they use only non-toxic water-based paints and finishes. And y'all, these crates are so freaking adorable. The Bond With Me Panda Crate comes with a Tummy Time mirror that can be used in multiple different ways. There are these really cool black and white high contrast image cards that support babies' visual development. There's a super cute milestone pillow and cards to track your baby's milestones, plus other at-home activities to connect and bond with your baby. And y'all, these crates ain't just cute, okay? They also support your baby's rapid development in the first 2 years of life with science-backed products that support child-led play and encourage open-ended exploration. Each KiwiCo Panda Crate includes age-specific products that are designed by experts and backed by research. I would have loved to have something like this for my babies. Unlock brain-building play with KiwiCo Panda Crate. Get 50% off your first month with code Dr. Nicole at kiwico.com/panda. That's 50% off your first month at kiwico.com/panda, promo code Dr. Nicole. So, a few lessons from this story. Number one, if you have a problem in pregnancy, start with calling your doctor's office. There's typically someone on call 24/7 who you can speak with to help you decide if you need to go to the hospital. It's a doctor, or some practices, it's a nurse. Now, I will say that some practices are not supporting having 24/7 availability of someone to talk to as much anymore. So it may be a challenge, but it's still a good place to start. And speaking of which, go ahead and ask your doctor right now what you do if you have a problem after hours, in your pregnancy, who you call, how does that work? So you're not trying to scramble and figure it out in an emergency sort of situation or in a situation where you have some concerns. Really, calling 911 should be for true emergencies, like booming out contractions. Oh my God, the baby's coming, lots of blood, passing out, like really true emergencies for 911, not a couple of minor episodes of abdominal pain. The second thing is try not to panic. I know it's hard. Our society has created this energy, this stigma around pregnancy that it's this medical condition. It's a disaster waiting to happen. You have one contraction, two contractions based on TV or the movies. And oh my God, we got to get everything. We got to get water. We got to run to the hospital after 30 seconds of TV in the movie. And that's just not the reality. Yes, things can happen that are definitely emergencies in pregnancy, but they are rare. All right. So try not to panic. Try to take a deep breath, assess if something is really truly an emergency. Pregnancy is a normal, natural condition that's been happening for literally billions of years. So take a step back and realize that most often it's not an emergency and you have a minute to kind of assess things and get yourself to a hospital that can best serve you. Speaking of which, number 3, if at all possible, when you have a problem in pregnancy, especially if you are after 20 weeks, go to a hospital with a labor and delivery unit. Please, 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 please. Now, I understand if you have difficulties, you're in a rural area, there's not a lot around you. Maybe it really is truly an emergency and you cannot get to a hospital that's further. But hospitals or those freestanding emergency departments, something that's not connected to a hospital with a labor and delivery, they are not equipped to deal with pregnancy issues. They are very skilled doctors and they are good at emergencies outside of pregnancy, but for pregnancy, they don't have the training, they don't have the knowledge, they don't have the expertise, particularly if it's after 20 weeks, okay? And all it ends up doing is delaying care. It just delays care. So if it's an extra 10 minutes or 15 minutes for you to drive to a hospital with a labor and delivery, you're almost always going to be better off driving to that hospital with labor and delivery. It's going to be the extra 10 or 15 minutes is going to be less than the time it takes for you to be evaluated at the other place and then get transferred to the other hospital. As you heard in this story, it's not as straightforward as you think to just get transferred to another hospital. The ambulance has to come. That takes some time to get there. The ambulance has to go to the other hospital. It's not like you come in, you get evaluated, and 10 minutes later you're out the door. It just does not work that way. This is a fairly common occurrence that if you're at a place that's one of those freestanding ERs, it's going to take at least an hour typically for an ambulance to be available to take you to another place. So instead of stopping at the first place, because you hear the advice, I get it, you hear the advice, go to the closest hospital, go to the closest hospital. But in pregnancy, it needs to be go to the closest hospital with a labor and delivery unit. You will be served faster. You will get the care that you need faster. And I forgot to mention that one of the ways to reduce that sense of panic is, of course, childbirth education. I have a childbirth education option called the Birth Preparation Course. It's my online childbirth education class that gets you calm, confident, and empowered to have a beautiful birth. But there are lots of childbirth education options out there. Just please find one that works for you. Do not skip childbirth education. It is so, so important. All right. So that's it for this short episode. Please share the podcast with a friend. I am on a mission to reach and serve as many pregnant folks as possible, and I would love your help in doing so. Also, subscribe to the podcast in Apple Podcast or wherever you're listening to me right now. If you love the podcast, leave me a 5-star review in Apple Podcast. Helps the show to grow, helps me know what you think about the show, and helps other women know what you think about the show. And speaking of helping me know what you think about the show, shoot me a DM on Instagram. My DMs are open. I'm on Instagram at Dr. Nicole Rankins. Come follow me there, not only to connect outside of the podcast, but to get great additional information about pregnancy and birth. So that's it for this short episode. Do come on back next week and remember that you deserve a beautiful pregnancy and birth.